It's notes from No More Hygiene. And Dr. Nabors, I understand we're going to Europe today. Tell us what's up and what's new.
Well, it's interesting. One of the things that we're trying to stay on top of is information that's coming out right now, not information that came out 20 years ago, and all of the foundational principles that we talk about have been around for a while. This article just came out yesterday, and it's called Gum Disease Linked with New Onset Heart Disease, and it's from the European Society of Cardiology. It was a headline article. It was this, like I said, it just came out yesterday. And the premise of the article is gum disease is associated with an increased risk of cardiovascular disease, which we know and we talk about quite frequently. The more severe the periodontitis, the higher the risk. Also, we've talked about that. The thing that's really cool about this is they're bringing the associations now that they're even higher in people that have had heart attacks prior. So if you've had a heart attack and survived, then your risk is really drastically increased if you have periodontal disease.
How much?
This study was over 6 years long, so it's very different than your typical dental study. This was almost 6.5 year study. They had 205 endpoints. And essentially their summary is that you are at a 49 or 50% higher risk of having a heart attack than those people with healthy gum tissue. And that basically just reaffirms what we've been talking about now for almost 8 years, and these associations to these systemic problems. And this was presented in a European cardiology journal, not a dental journal. There wasn't anything periodontist, periodontal, ADA, JADA, nothing. This was pure medicine. And they're really talking about these correlations. And it's just fascinating to me.
So 50% greater chance, again, validates what we already know, but also something new to talk to your patients about, especially those that have a medical history of heart conditions.
Absolutely.
So we will include the link to this research along with this video so that you can read through all the details. Again, one more reason to be doing modular periodontal therapy and treating disease, saving lives, grow your practice, and look forward to seeing you for our next No More Hygiene course. Thanks for sharing with us, Dr. Nabors.
Absolutely.